A woman is 26 weeks pregnant. During her checkup, the baby's size measures only 24 weeks and an ultrasound shows very little amniotic fluid. What is the most likely cause? The right answer is option C, renal agenesis. During the second half of pregnancy, most amniotic fluid comes from the baby's urine. If the kidneys do not develop, the baby cannot produce urine, leading to low amniotic fluid. Rabies is most commonly spread by dogs, especially in developing countries. What is the best and most cost-effective way to reduce rabies cases? Here the right answer is option D, reduce the stray dog population and vaccinate all dogs. Controlling rabies at its main source is the best way to prevent the disease in humans. A new cervical cancer screening test increases a woman's life expectancy by 15 years. If her health utility score is 0.8, which health measure can be calculated? Right answer is option C, QALY, that is Quality Adjusted Life Year. It measures both the number of years gained and the quality of those years by multiplying life years gained by the health utility score. A 7-year-old boy develops abdominal pain, vomiting, reduced urine output and swelling around the eyes after chemotherapy. His blood tests show high uric acid, high creatinine and high potassium. What is the best next treatment? The right answer here is option A, hydration. Aggressive IV fluids are the first step in treating tumor lysis syndrome because they help protect the kidneys and flush out uric acid. A 1-day-old baby has not passed urine since birth. What is the next best step in management? The right answer here is option C, continue breastfeeding and absorb. Many healthy newborns pass their first urine within the first 24 hours, so careful observation is appropriate if the baby is otherwise well. A patient has fever, night sweats, a drooping eyelid and weakness on both sides of the face. A chest scan shows enlarged lymph nodes on both sides of the lungs. What is the most likely diagnosis? Here the right answer is option D, sarcoidosis. Enlarged lymph nodes in both lungs together with facial nerve weakness is a classic sign of this condition. A woman has a one-sided headache with nausea, sensitivity to light and sensitivity to sound. What is the best medicine for immediate treatment? The right answer is option C, sumatriptan. Sumatriptan is the preferred medicine for treating an acute migraine attack, while the other drugs are mainly used to prevent future attacks. A 65-year-old man develops sudden, violent flinging movements of one side of his body 2 days after a stroke. Which part of the brain is most likely affected? Here the correct answer is option C, subthalamic nucleus. Damage to this area causes hemibalismus, which leads to sudden uncontrolled flinging movements on one side of the body. A person wakes up after sleeping with one arm trapped under the head. The arm is weak but there is no numbness. What is the best explanation? Here the right answer is option B, that is A fibers are more susceptible to pressure than C fibers. Large motor fibers are compressed more easily, causing weakness, while pain fibers are less affected. A woman is 4 days after giving birth and complains of tearfulness, mood swings, and occasional difficulty sleeping. What is the most likely diagnosis? Here the right answer is option D, postpartum blues. It usually begins within the first week after childbirth and causes mild emotional changes that often go away on their own within 2 weeks.